Good afternoon. I welcome you all to this Facebook Live program organized by Maa Hospitals Private Limited. Today's topic we'll be discussing is common ENT problems. Due to COVID 19, many of us are not able to walk out. We, being doctors, have the special privilege to go around and then visit hospitals, but most of our general public is locked down at homes because of the safety measures they have to take in this pandemic. So the common ENT problems most of us face in day to day life are the discharging ears. So the common causes for discharging ears is commonly it's otitis externa. That is nothing but inflammation of the external auditory canal. It could be due to different bacteria, could be because of fungus, could be because of allergy. And the common precautions you have to take is see that the no water gets into the ear. Uh, no, I'm yet to receive. I thought there was a question for me. So, if it's a bacterial infection, there will be purulent discharge and there will be a lot of pain. And so, based on that, generally we prescribe antibiotic, but and painkiller and a oral antibiotic and local antibiotic ear drops. I received a question: what precautions should be taken to prevent sore throat? The commonest precaution you should take is you should not eat anything ice cold. If you take anything ice cold, there is more probability of pharyngitis, tonsillitis. The other thing could be to avoid fried foods. You should not take fried food because that will also lead to pharyngitis. And the other thing being to avoid outside food, which will generally is responsible because of contamination of water and poor hygiene. This all will lead to the sore throat. And the common things associated with sore throat are sometimes it is because of severe tonsillitis, pharyngitis, and this can even be associated with ear pain because the same nerves which supply the throat also supply the ear. So patients may sometimes feel ear pain in sore throat. So you should not think that is some ear pathology. It is because of the severe throat. You get the referred otalgia. The pathology is in the throat, but you get pain in the ear. So these are the common things uh, about the sore throat. So this can be easily prevented by eating outside food and by preventing intake of ice cold items. So till I receive another question, the other common thing is the common cold. Common cold is now really creating anxiety among most of us. If somebody is having little running nose and little cough, they are really worried about the pandemic, that is COVID-19. So I don't think everybody should be really worried about just because of little cold and cough, because most of the times it is because of allergy. So these allergic patients, they have the running nose and a little dry cough, and this there'll be history of previous episodes also. So they need not be really panicky about this COVID-19 unless there is a history of travel in the recent past, or there is history of exposure to a positive COVID-19 patient, or probably if he's staying in overcrowded areas and he's not aware of his neighbors and he has mingled with them, then probably he should take precautions by doing self quarantine. And if the test facility is there, probably he should undergo the COVID-19 testing by taking a nasal swab and a throat swab. So these are the common things which we encounter in day-to-day life as far as ENT problems are concerned. And the other thing is again, most of us have ear pain. So the common causes for ear pain without discharge is most of the times it is the wax. Wax is nothing but the secretions of the gland which line the skin of the external auditory canal along with the dust. So these together form the wax, and the wax is associated with pain when it becomes really hard, and it also causes little hearing loss, which is conductive in nature. So this can be easily relieved by putting grandma's old theory, putting oil and softening the wax in the COVID-19 time, or otherwise you get various wax softening agents like D-wax drops or Solivax drops. These are the different brand names. So these drops should be used at least 4 to 5 times a day for about 1 week time, and then the you should consult a doctor, and this wax becomes soft and it can be easily removed. So these are the things which you should be really uh, coming across as far as problems are concerned. And coming to the oral cavity, especially in people who smoke, and people who take tobacco in the form of gutka, or they constantly take betel leaves and betel nuts, so they are prone for recurrent oral ulcers. So the best part is here is prevention. So the intake of these betel nut leaves, and tobacco in any form is very very hazardous. So apart from the oral cavity ulcers, it can lead to cancer of the oral cavity, then the cancer of the pharynx, cancer of the esophagus, and then down the line it can affect the lungs. So it's like a termite, it can affect the entire body in some way or the other. So consumption of tobacco in any form, whether it is in the form of smoking or in the form of uh, like gutka or anything, should be avoided, and these oral ulcers can be prevented. The other causes of oral ulcers could be traumatic. So sometimes the sharp teeth, they can also lead to ulcers on the tongue due to accidental biting of the tongue. So these ulcers, most of the times, they heal by themselves. So whenever you have these traumatic ulcers, you should avoid spicy food and hot food, because it will cause a lot of burning sensation, and you should take soft diet and non spicy food. So that will help in patient to overcome the crisis uh, of severe pain, which can be avoided by taking a non spicy food and a soft diet. Any question is there? So apart from this, the yeah, I got a question. So, how do you take care of discharging ear? So, the common causes of discharge from the ear are one, as I told you, it could be just infection of the external auditory canal, or it could be infection of the middle ear. So, when it is infection but of the external auditory canal, generally it is not associated with any hearing loss, and there will be a lot of pain, and so that can be easily taken care by using antibiotic, whichever the patient is comfortable, whichever patient is not allergic to, and for 5 days, and then putting antibiotic drops. And the most important precaution is no dirty water contaminated with soap or shampoo while taking head bath should get into the ears. So they can use a cotton soaked in coconut oil, or applying a Vaseline to the cotton should be kept in the ears, so that no dirty water infection should get into the ear. The other cause of discharging ear, chronic discharging ear, is chronic suppurative otitis media, which is associated with a hole in the eardrum. There is a perforation of the eardrum, and that will be associated with a history of hearing loss. And so in that case also, first important precaution is no contaminated thing should get into the ear, and subsequently if the patient does not respond in case of discharging ear, the discharge continues, then the discharge should be sent for pus should be sent or the discharge should be sent for culture and sensitivity, and based on that an appropriate antibiotic should be given. And suppose there is a hole and which is associated with chronic suppurative otitis media, then probably once the discharge stops, if it is of safe time, then he has to undergo surgery for the repair of the hole in the eardrum. The another question I got live now is how to take care of snoring in my 5-year-old child. See, in children, the commonest cause of snoring is adenoids. So, adenoid is a lymphoid tissue similar to tonsil. Tonsil is present in the oropharynx, that is in the throat, and the adenoid is present at the junction of the roof and the posterior wall of the nasopharynx. So, when a child takes breathe through the nose, when there is an obstruction in the nasopharynx, invariably he will open mouth and tend to breathe. So this will lead to snoring. So we diagnose the enlarged adenoids by either taking an X-ray nasopharynx lateral view, or if the child is cooperative and old enough, then a diagnostic nasal endoscopy can be carried out. And based on the size of the adenoid, generally more than grade 2, grade 3 and grade 4 adenoids have to be removed surgically, so that this crisis of snoring can be we can come over, and patient will not have any complications associated with enlarged adenoids like adenoid faces, or the ear issues like otitis media with effusion. So all these issues can be resolved by doing a simple adenoidectomy, which can be using a coablation technique, which is very safe and it ensures complete removal and with almost zero blood loss. So this is how we can take care of snoring in children. And the other causes which have to be ruled out is sometimes there may be a congenital deviated nasal septum, and there may be sometimes enlarged turbinates which can also cause nasal blockage. So we have to rule out all those, and most of the times it is adenoid which is responsible for snoring in children. And parents are really panicky. They get the recorded videos of a child during sleep and show it to the doctor, saying that my child is making a lot of sound, and it is very disturbing and very scary to see him making such sounds during sleep. I think I the next question I got it. How to take care of change of voice. So change of voice, it all depends. There are so many conditions which are responsible for change of voice. The causes could be systemic. Suppose a patient is generally a female patient, and who is complaining of change of voice, chronic change of voice. So probably we have to rule out, most commonly is hypothyroidism. So hypothyroidism is the most commonest cause of change of voice in females. So after ruling out thyroid cause of the change of voice, the other causes could be the local causes. Local causes could be, there could be any growth. It could be a polyp, or it could be a benign tumor like hemangioma, or papilloma. So all these things have to be ruled out by doing a endoscopy. So we can do a video laryngoscopy, which is an outpatient procedure. So those uh, conditions can be ruled out by doing a simple video laryngoscopy. And this change of voice following surgery can also take place, following a thyroid surgery or any cardiac surgery or any other head and neck surgery, where there is maybe injury to the recurrent laryngeal nerve. So that can also lead to change of voice. So if it is a thyroid condition, then supplementing the deficiency of the thyroxine by giving supplementation can take care of the change of voice. And other conditions like local causes, probably they have to be surgically operated. Oh, sorry, 1 second, there is some technique. These are the common causes, apart from blood pressure, sugar, the other local causes could be some intracranial pathology within the brain. If there is something like some tumor, space occupying lesion, or ear causes. So ear causes are generally associated with loss of hearing, Meniere's disease. So if it is associated with loss of hearing, then probably you got to visit an ENT doctor. If it is associated with any brain symptoms like headache, then probably you got to see a neurophysician. And if it is because of high blood pressure, then probably you have to see your physician. And if you are a diabetic, then again you have to see an endocrinologist. So there are 101 causes for this giddiness. The next question for me is, I went through sinusitis surgery 3 years back, but I frequently undergo throat irritation and cold whenever there is a change in weather. What precautions to be taken, doctor? Yeah, this is a very good question. As you have undergone surgery 3 years back for your sinuses, but still you get irritation in the throat and cold whenever you get there is a change of weather. Probably, I think you have some seasonal allergy. So seasonal allergy typically leads to this kind of symptoms. It's not related to surgery, I think, because you were operated 3 years back and you are getting symptoms only when there is change of weather, right? So when there is change of weather, you are getting irritation in the throat and also a bit of cold. So this can be easily prevented by taking anti-allergic medication when there is a change of weather. Prevention may not be that easy because you have to live in the same weather. The weather cannot be changed for you. You got to adapt to the weather. So probably that time you can take some anti-allergic medication, which may be in the form of a nasal spray or anti-allergic tablet, any antihistamine tablet. So that will help you. And I don't think it's a serious issue, and you can't prevent it except probably you got to take medication for that. So these are the common things. Because of the allergy, you get irritation, throat irritation, little bit of itchiness in the nose also, and then you get running nose, and and you feel fatigued, and myalgia. So these are common things associated with allergy. Whenever you get allergy, whether it is seasonal allergic rhinitis or perennial allergic rhinitis, so all these things are common, and I don't think you got to be really worried about this issue. And this is a simple thing and which can be easily tied over by taking medication, maybe for a week to 10 days. And coming to other things is again headache. Headache has become, of course, most of the headaches everybody attributes to sinus, but it's not the case. The headache can be because of lot of stress, lack of sleep, uh, and then probably again not taking a food intake on time. So these are the different things, but most patients, as soon as they get a headache, they feel that they are suffering with a sinus issue and they visit an ENT doctor. And but it's not true. So headaches, of course, sinus, most of the time the sinusitis presents as headache, but headache all headaches cannot be attributed to sinus disease. So never presume that just because you are having headache, you are having a sinus issue. So all headaches, don't be under the impression that you are having a sinus issue and you got to undergo some surgical treatment. Because if it is allergy, if it is allergic sinusitis, then probably you also need medical management for the allergy issue. So these are the few things which you got to keep in mind before you rush to a doctor, because every time you cannot go to a doctor. And so you got to be really have some basic knowledge about this before you rush to a doctor. So apart from this, the other common ENT problem which we encounter is the ear pain. Ear pain is one thing which is very annoying to the patient, and patient wants an immediate relief. So the common causes for ear pain is a furuncle. If a furuncle in the external auditory canal leads to very severe pain, it's nothing but infection of the hair follicle lining the skin of the within the skin. There are hair follicles, and when there is infection of the hair follicle, it leads to very severe pain in the ear, and that will be very annoying for the patient. So, and the other causes of ear pain or severe ear pain is acute suppurative otitis media. So, where you find again, it is generally associated with history of upper respiratory tract infection, where there will be history of patient having some cold or some throat pain, and followed by severe ear pain. And the other thing is commonly it is associated with following episodes of beach parties, where there will be a lot of water getting into the ear, and there will be a lot of moistness in the ear leading to fungal infection. So in those conditions, the patient will feel itchy ear and will be associated with pain. Another question I got is tinnitus can be cured? This is a very wonderful question. And what is tinnitus? First of all, I want my viewers to know tinnitus is perception of sound in the absence of external auditory stimulus. When you are perceiving sound, when there is no sound production outside, it is called as tinnitus. So the tinnitus could be for different causes. There are different causes for tinnitus. One is simple wax in in the external auditory canal can also lead to tinnitus, but most of the times it is inner ear pathology, and we prescribe cochlear vasodilators for that. And in some of the case patients, they respond very well, and some of the patients the response is not that great. And so I cannot say it can be 100% it's a curable thing, but definitely, and in some conditions where this medication does not work, we advise tinnitus maskers, so that will avoid irritation of constant irritation of this sound to the patients. The next question I got from one of the viewers is, my mom is having snoring problem. Any medications for this to overcome? See, as you know, snoring is another common problem, and there are different factors which attribute to the snoring. First, the systemic causes. If the patient is obese, I don't know how, what is the weight of your mother. If she is obese and if her BMI is normal, BMI should be less than 24. If her BMI is more than 24, and if she is obese, those things, obesity should be first controlled to prevent snoring. And the other causes are any obstruction right from the nose till the lungs. If there is any obstruction anywhere, that can also lead to snoring. The other thing is there are snoring are again sorry, and sometimes it may be associated with apneic spells. So there could be central apnea, which is because the brain fails to respond to the hypoxemia, or the peripheral apnea. This in this, when there is an obstruction, we have to do DISE, that is drug induced sleep endoscopy, to know the site of obstruction when all the muscles are relaxed, and based on that the treatment can be given. But first basic thing is, if the your mother is obese, take care of the obesity, visit to a dietitian. And secondly, if she's not obese and still she's snoring, then probably you got to get her to an ENT doctor. And if she's not fit for surgery, the and she's having apneic spells, like suddenly she gets up from sleep, uh, because of air hunger, then you have CPAP machines or BiPAP machines which can be used. So these are the few things which are by which you can manage snoring. And snoring is sometimes fatal if it is associated with apneic spills. So we advise in patients who are not fit for surgery the CPAP machines or BiPAP machines. So these are the things in the management of snoring. And then coming to the ear pain we were talking about, so that as we discussed, the furunculosis, the otitis externa, and then the acute suppurative otitis media. These are the things which are commonly responsible for ear pain, and most of the time you need a support of an ENT doctor to manage, because probably self diagnosis and treatment may not be possible except taking a painkiller in the time of emergencies. So these are the few things which we got to know before we really rush to a doctor. Anything? And luckily now, because of lockdown, there is no pollution. Otherwise, because of lot of pollution in the air, because of vehicular pollution. I'm sorry, I got a question. Ah, now everybody knows. Somebody is asking me any suggestions on COVID-19. So I need not give any extra suggestions. The only suggestion I can give you is stay home, stay safe. So prevention is the best thing. And suppose if there is an emergency and you want to step out of the house for some reason, then probably you put on a mask and don't go into crowded areas, maintain social distancing, because that's the thing which can help in protecting yourself and preventing the spread of COVID-19. That's the most important thing. And every government, every health platform is repeatedly emphasizing on social distancing. So please, please, please avoid crowded areas. Put on mask when you step out. Don't unnecessarily step out of the house. Only if it is a dire emergency, then only please step out. Take these precautions. By taking these precautions, you'll not only helping yourself, the society, the country, and the world. So please, please, that's the only most important suggestion I can give you regarding COVID-19. So these are the few things which you should follow in this pandemic of COVID-19. So I was discussing about the pollution. Now the pollution has come down. Otherwise, generally, when the life is normal and there is no lockdown, and when there are a lot of vehicles, so the pollution is mostly responsible for all our nasal issues. Most of the nasal issues, like we'll have recurrent sneezing, running nose, then throat pain, because all polluted air will be inhaling, and that polluted air will be irritating our mucosa, the nasal mucosa, the pharyngeal mucosa, and that will cause all the problems. So luckily now we don't have that issue, but there are so many other issues to tackle which are more challenging. So in that time, probably we have to use like mask we are using. Probably if somebody is using a two wheeler, then also that time I think they can use some kind of a mask, so that will prevent the exposure to the so many environmental pollutants at that particular time where there is lot of pollution in the environment. So that is one important thing to take care of environmental pollution, prevent exposure to the environment pollution. Another question I got is, uh, I am suffering with cold morning and evening past few days. Please suggest me. I don't think you really got to worry about it, because I don't think you are having fever. So probably it's just common cold, and probably you got to you go to a doctor, next door doctor, and probably he will prescribe you some antihistamine which will take care of your cold, because that is not a serious issue. Don't think of anything regarding the pandemic. There is just a common cold, the way you have presented the question. So I feel you got to take just visit your family physician or the nearest doctor, and probably you may have to take medicines for about 1 week time, and that will take care. And meanwhile you can start steam inhalation. That may help you to tide over the crisis. If the doctor is not available right now, then probably steam inhalation may help you. So that can take care of your cold. And as I told you, don't unnecessarily step out of the home, and stay safe and stay at home during this pandemic. And this common cold, you will not be really worried. I think that needs little bit of medication. And regarding the common ENT problems, the another common problem we have is regarding the throat pain. Throat pain, they generally patient comes and says that throat pain with some kind of foreign body sensation, and on an examination we find everything is normal. And the patient repeatedly comes to us after endoscopic evaluation, and after taking all the other investigations, blood, complete blood picture, everything is absolutely normal, but patient still complains of something, some lump in the throat, and with some vague pain in the throat. So probably that is an anxiety related disorder, and that is called as globus hystericus. So for that, patient needs counseling and no medical medicines. So I think that should be taken care of. And apart from that, most of these patients who have this problem, they are I'm sorry to say, but most of them are females. So they have this problem, and this is a psychological condition which has to be taken care of, and it does not require any medical or surgical intervention. Thank you. Thank you, one and all. థ్యాంక్ యూ. క్వశ్చన్స్ రాలే మేడం, మధ్య మధ్యలో ఏం మాట్లాడాలి, ఎక్స్టెంపర్.